In today's video, we'll talk about the chest muscles. The anatomy of the chest muscles are two major muscles, pectoralis major and minor. A lot of people refer to these muscle groups as the pecs. Then we'll be following massage techniques in a lot of different positions. The reason for that is we want to address the modification and different positions in regards to a male and female athletes. So the tissues that overlie the chest muscles, the similarities are connective tissue, adipose tissue, and cardiovascular for both male and female. But with the female breast tissue, you have mammary glands as well as other structures that if we do direct deep pressure on the breast tissue, we may run the risk of damaging those structures. So we're going to do some modifications as well as different positions. With the anatomy portion, we're first going to go to the computer and then to the book. Now on the computer, on the bottom left-hand corner, the muscle right here is pectoralis major. So it attaches to your collarbone, the breastbone, also called the sternum, and as well as the first 6 ribs to attach to the arm bone. Here in gray, you have the deltoid, just on the outside part of the pectoralis major muscle. Here on the left, you'll see a smaller muscle. This is pectoralis minor. It attaches to the front of the shoulder blade to attach to the 3rd, 4th, and 5th ribs, just off of the cartilage. The picture on top shows it very similar, but also shows the attachment of where pectoralis major is on the arm. And on the right side here, just another view of pectoralis major, the deltoid and biceps. So this is the area when we did the video for the arm that this can be a sticky point that needs to be addressed. And then over here for pectoralis minor, you have another muscle coming off as well as serratus anterior. So this muscle is deep to pectoralis major, so we have to go through the muscle as well as under the muscle to get to pectoralis minor. Now we'll move to the book. In the book, on the bottom left-hand page here, here's the pectoralis major, again attaching to the collarbone, the sternum, as well as the first 6 ribs, and moving in to tucking underneath the deltoid muscle and on top of the bicep muscle to attach to the arm. So again, this is the area that you need to work on to relieve any adhesions or stickiness that may occur. The next page shows the pectoralis major on its own, and you can see its attachment on the arm. The biceps tendon runs underneath it, and then the deltoid, which is in this open space here, will cover a portion of pectoralis major. The next page shows pectoralis minor. Here, attaching to the front of the shoulder blade and attaching to rib 3, 4, and 5, which we'll landmark on Frank. And then here is the attachment points. So that's the front of the shoulder blade, and here it attaches to the ribs just outside of the cartilage. And then over here on the top right, it shows how it is deep to pectoralis major, which is in gray, and in red is pectoralis minor. So we could go through pectoralis major or underneath it to address it. In the next book, it will show the muscle along with the abdominals. We have to also consider that when we were treating the pectoralis muscle major, it is far down as the abdominals, especially external obliques, which are located right here. And it has a common attachment point as well. There's a slip of aponeurosis, which is a term named for a different type of connective tissue. So here's pectoralis major, and here is the external oblique muscle, along with the connective tissue. Another page, and this is where we were talking about the differences between male and female athletes, and in order to address the chest muscles, is that for the females, This is the breast tissue along with mammary gland as well as other structures within the breast tissue. So with the modification for female athletes, when they treat with self-massage techniques, they would have to move their breast tissue in order to treat the pectoralis minor, and major. If you are doing very deep techniques, because again, there may be a risk of damaging those structures within the breast tissue. And now we will move to Frank.